My name is Alexis Danis. I'm the founder and CEO of Translational Osteosynthesis, a University of Michigan-based startup dedicated to bringing novel orthopedic devices and therapeutics from the research bench to the bedside. At TO, we're pushing the boundaries of radiolucent fixation by developing osteosynthesis devices fabricated completely without metal. This is made possible by using low thermal property reinforced thermoplastics in combination with ultrasonic heat staking techniques for safe and effective implantation. This ensures enhanced mechanical strength by locking the fasteners to plates and bonding them to bone, and it's comparable to the method of hot riveting popularized by Gustav Eiffel during the construction of the Eiffel Tower. Traditional metal osteosynthesis devices produce imaging artifacts that prevent adequate visualization of bone healing, thereby limiting accurate diagnostics and confounding treatment planning with regards to load-bearing decisions, time to hardware removal, and oncologic management. Metal devices also produce stress shielding effects due to an elastic modulus that is much higher than bone, yielding suboptimal bone regeneration, weakening of reconstructed bone over time, and unwanted failures. RFS devices facilitate accurate diagnostic assessments and oncologic monitoring, and their modulus of elasticity is comparable to cortical bone, thereby eliminating stress shielding effects and improving the likelihood of successful bone regeneration and bridging. We formed a partnership with Mobius Precision, a 13485 certified orthopedic device manufacturer, for scaling and GMP production planning. Reportedly, 1.5 to 3 million patients present with non-unions in the U.S. annually. Another large proportion of patients present with bone defects due to trauma or tumor removal. These patients all require reconstruction and enhanced visual monitoring with conventional imaging. Our milestones reflect both preclinical and clinical development steps over a 4-year timeline. This progression will allow us to commercialize our preclinical devices and collect revenues to help offset costs related to clinical developments. We plan to apply for a Class 2 device designation via the 510(k) pathway with CarboFix's Piccolo device as the primary predicate. Reimbursement will be sought through direct sales in partnership with an established vendor or licensing fees for the use of the technology by an established device manufacturer. Assuming a 10% market penetration and assuming the RFS technology can be sold as a device comparable to metal counterparts at approximately $2,000 to $5,000 per procedure in these cases, initial RFS revenues are estimated at $800 million annually. Our future funding plans are a Phase 1 and Phase 2 STTR for clinical scaling and development. In fact, we've been invited to submit a full P1 NSF STTR application based on a successful project pitch, and beyond that we will seek venture funding. Thank you.